At this hospital in Kisumu City, Western Kenya, medical workers are treating children sick with malaria. For Laura Odhiambo, bringing her daughter Leah to hospital was not an easy decision.
The fear of COVID is there because one, we were told to stay at home. Now I have to expose her to a hospital facility. And you know, in the hospital, there are so many diseases, leave alone the COVID. There are so many other infectious diseases, but I have to bring her here. That is another risk on her side. The another risk is on my side because I'm going to interact with a number of people who might in one way or another be infected and will end up infecting her. So the fear is there.
Medical workers say many people suffering from malaria are staying away from health facilities.
We've realized during this COVID-19 pandemic period, most of the parents have shied away from coming to the hospital, putting into consideration that they fear themselves getting infected or getting affected in one way or another concerning the issue of COVID-19.
Kisumu is in the heart of what's called Kenya's malaria belt, where outbreaks of the disease are common. Stagnant water in rice fields like this one offer mosquitoes the perfect breeding ground.
I have another child who has also suffered from malaria, and myself. I used to suffer like an interval of 3 months, then I come back for malaria treatment. So it is a continuous, I don't think it is curing permanently or for a long time, but it's coming after a short period of time. I can give my household or myself like 3 months, then later on, malaria infection again.
According to the World Health Organization, the COVID-19 pandemic is disrupting routine health services that are likely to increase outbreaks and deaths from treatable diseases such as malaria. The crisis has also affected the availability of mosquito nets used to prevent the disease. Malaria is one of the leading causes of death globally and the second biggest killer in Africa, which accounts for 93% of malaria-related deaths in the world. While the eradication of malaria remains achievable in the coming decades, much will depend on whether this year represents a bump in the road or a U-turn. The next few months will prove critical as governments and the international community try to pull a delicate balancing act to keep both COVID-19 and malaria under control. Mohammed, Adow, Aljazeera, Nairobi, Kenya.